So many of you at home dealing with a cold or even, the flu, we're joined now by Dr. Perry Wilson, doctor, researchers at Yale and Yale New Haven Hospital, to answer some of your questions. So, the basic thing first, Doc, the flu and the cold right now, is it worse this year right now in Connecticut?
It is pretty bad. We are in really the peak flu season right now across the country and in Connecticut. There have been more cases of flu every week since about October when flu season started. Typically, we start to see it tail off around mid-February, so keep your fingers crossed for that, but it's a bad year.
Pauline on our Facebook page for NBC Connecticut writes, it's been a month, I'm getting better, but why is it taking so long? I'm 77 years old.
Yeah, it's not uncommon, unfortunately. These flu viruses and other respiratory viruses can really linger, often not in an infectious state, but particularly the cough can last for 4, 6, even 8 weeks after an acute infection. There's not a lot you can do about it except sort of muscle through.
This from Linda, can the flu shot actually wear off?
Really interesting question that some new research is starting to look at. Nothing compelling yet suggests that it's going to wear off too quickly within one season, and there's no recommendation to get a booster shot in one season, except for certain cases. Kids under the age of 8 who have never had a flu shot before do require 2. We're looking at that very closely, and you might see in the future some more new recommendations along those lines. But for now, just 1 per year is fine.
Now, the numbers out there we were discussing on the phone, maybe about 50% of the time the flu vaccination works.
It varies from year to
What does that
year.
mean?
Yeah, it varies from year to year, and the CDC tracks what they call vaccine effectiveness. This year, it's around 50%, which is about average for the vaccine. And what it means is that you're 50% less likely to contract the flu if you've received the vaccine than if you decided not to get the vaccine. So it's not perfect, but it's pretty good odds.
Fact or fiction, doctor, going from hot to cold, cold to hot leads to illness, leads to maybe the flu?
No, it's not particularly comfortable, and this is something my mom told me too. Going from hot to cold or going outside with your hair wet, that doesn't lead to the flu. The thing that leads to the flu is not having good hand hygiene, so wash your hands, everybody. And of course, if you're exposed to someone with the flu, encourage them to be really careful, to cover their mouth when they cough, and to wash their hands as well.
And very quickly, doctor, if you have flu-like symptoms, best thing to do, urgent care perhaps?
Your primary care doctor, urgent care. It can be hard to tell the difference between flu, which can be quite serious, and a very bad cold. So ask a health professional to help you out.
And one final question from our viewers. Christina asked, do disinfectants around the house really help prevent getting a cold?
Yeah, absolutely. The cold virus can linger, and flu viruses can linger on surfaces, so disinfectants, particularly ones that have a little bit of bleach in them, can help reduce the risk of transmission.
Dr. Perry Wilson from Yale and Yale New Haven Hospital, we appreciate the time. The pride of Guilford. You'll make Ryan Hanrahan very happy.
Anytime.
You.
Thank you, Kevin. Thank you, Dr. Wilson.